Dear students, my name is Zsuzsoka Kecskes and I'm the director of the ANU Medical School. And on behalf of all my colleagues, I'd like to welcome you to the school. We look forward to meeting you and we look forward to helping you become the doctors of the future. I'd like to give you a bit of an overview of the school, outline what we expect from you, tell you what you can expect from us in the next few minutes. But I'd like to start off by acknowledging and celebrating the first Australians on whose traditional lands we meet, and pay my respects to the elders of the Ngunnawal people, past and present. Now, I don't know how you feel, but you might feel a bit of excitement. You might also feel a bit of trepidation and not quite sure what to expect. That is completely normal. We are here to guide you through the program because we want you to be the future doctors. So if there's anything you don't understand, anything that doesn't make sense, anything that we can help you with, we want you to talk to us, and you can email us at any time. Now, the first thing you might ask yourself is, why is this degree not called an MBBS or an MD, but called an MCHD? Now, MCHD stands for Medicina ac Chirurgica Doctoranda. That is Latin for being a doctor of medicine and surgery. The reason why the ANU has chosen this name for this degree is to differentiate itself from the MD that's already available as an ANU qualification, and to differentiate itself from other undergraduate degrees, the MBBS or BMMS, because this is a postgraduate degree. Now, as graduates, will you be allowed to call yourselves doctor? Yes, you will be, because our program is a level 9 AQF program, an extended program, and anybody who has a master's degree in any of these programs, such as medicine, physiotherapy, dentistry, optometry, and veterinary practice, are allowed to call themselves doctor after graduation. So what are we trying to teach you, and what will be your experience, and what are we trying to achieve? When you graduate, hopefully in the next 4 years, you will be able to work safely and effectively as an intern. You will be able to deliver quality care as a member of a health professional team, whether that'll be in the hospital, general practice, or in a rural setting. You'll be conversant with issues in Aboriginal and Torres Strait Islander health and well-being, and you will have an understanding of the social foundations of medicine. You will be equipped scientifically, clinically, and professionally to do your job. You will have a strong sense of global connection. You will have learned in a research-intense environment, and you will have a commitment to lifelong learning. Now, being in a medical school and doing the medical program can be just that, but there are lots and lots of opportunities for you during this program. During this program, you will experience medicine, whether it'll be in a hospital, community, medicine and health policy, in the lab, or in clinical research. You will be exposed to medicine, whether it'll be through the media, in different geographic areas, or in academia. And you will also experience different communities, some that are very well resourced and some that are under-resourced. Now, becoming a doctor seems to be a little bit like this tree with many branches and an array of roots leading to the stem of the tree. And the medical program is a bit like that, because you will all have had different paths to get into medical school. In the medical school, you'll be pretty much doing very similar things. So there's a common medical school experience, but it's after medicine that you can, again, take different paths and expand yourself and take opportunities. But remember, there are opportunities while you're in the program as well. So what can you expect, and what do we expect from you? What we expect from you is that you are becoming a part of the medical profession, and that is today as you set foot into the medical school for the first time. Now, this does come with obligations to your future patients, to peers, teaching staff and other health professionals, but also your family, friends, and yourself. You will serve your patients and the wider community, and what we expect you to do is serve with care, compassion, and humility. And we'd expect you to contribute productively to the program, whether it is that you're teaching yourself or that you're learning in research, but also in outreach activities. As I said, there might be uncertainty. What will it be like? Well, it is pretty hard work. It's intellectually challenging to become a doctor. The volume of work can be overwhelming. There is some competitiveness amongst your peers and between the years, but in general, you have already made it so far, and we are very confident that you will make it through this program. Will what you learn be relevant? Well, it might be difficult at times for you to see the relevance of what we're trying to teach you or what we're getting you to learn. But there is a thread, and it might be that it's not after a few years that you'll understand why we taught you certain topics. And it can be a bit overwhelming at times. Remember, you are not alone. All of you will feel like that. And there are heaps of support structures available, whether it's your peers within the school or beyond, that can get you through little hurdles. So what can you expect? Well, you can expect excellent teaching. We use modern teaching tools, modern teaching pedagogy, a variety of teachers. We have very generous patients who are also your teachers. There'll be a lot of exposure to different academics, clinicians, and other health professions. You can expect world-class research. We are the Australian National University after all. And this world-class research is not just available within our school, but also within the college and across the university campus. We have a code of conduct. That's not just for you. I would encourage you to have a look on the ANU policy website to find the code of conduct that is relevant to you, but you should have all signed a copy as well. However, we also need to adhere to a code of conduct, which means that we need to treat you as fair as we can. There is heaps of support available, and you should be expecting the support to be available to you when you need it. So where will the program run? Well, within the ACT, there are 3 different campuses where you will be exposed to medicine. This would be, of course, starting off on the ANU campus, but we have a medical school here on Canberra Hospital campus and on Calvary Hospital campus. Calvary is one of our partner hospitals in the north of Canberra, and Canberra Hospital, as you may know, the big tertiary institution in the south of Canberra. But you will also be exposed to rural medicine. All year 1 and year 2 students will do 1 week in a rural location. All year 3 students will do some rural placements, either 6 weeks, or if you happen to be a student who is lucky enough to get a full year in the rural environment, that'll be about a quarter of you. You will spend a whole year there. And there are opportunities for year 4 students to spend their time in a rural location as well. The locations that we have are the node towns of Bega, Cooma, Goulburn, Batemans Bay, Maruya, and Young and Kara, but there are satellite towns where the teaching will happen. When you step into this medical school as a medical student, we see you as a future colleague. So you are essentially already joining our profession. With that privilege come certain obligations that I talked about previously to patients and peers and so on. Professor Paul Gatenby, who's the Foundation Dean of the medical school, said, "A professional keeps on doing the job whether they like it or not." What that really means, whether you're in working hours, in a hospital, in a GP centre or not, once you are a medical student or a doctor, you continue to serve your patients and the wider community wherever you are and whenever that is. And I'd just like to remind you that as of this time, you are being seen as different. You're not just a member of the community. You will be seen as a future doctor, and with that come different expectations, and some things that you may have been able to get away with until now, you may not be as you are a medical student. So what do you do when you're feeling overwhelmed? Now, feeling overwhelmed is completely normal. It happens to most of you, and we know that this happens, and we know the times that it happens. So remember, you are not alone. The minute you start talking about that and share your experience with your peers or with us, maybe some of the load will come off your shoulders and you will realize that you're not alone, and that should make it a lot easier for you. There is a lot of support available from us, and you'll hear more about this. There are year coordinators, in the future clinical and academic supervisors. We've got associate deans that are there to help you, and of course the MedSoc. I would highly advise you, if you're not from Canberra, to get a GP. GPs are a fantastic resource to help not just with your physical health, but also with your mental health. And if you find that medicine is not the right future for you, it is okay to choose something else. Medicine is not the meaning of life, and some of you may find that it is not what you really want to do. Talk to us about that, and we can help you work out what it is that you want to do in the future. And what we really want to do is, in a few years, celebrate your graduation from medical school and welcome you into the medical profession. Just a few words on COVID. What you will see is that rules and plans change frequently. Trying to inform everybody, that's employees, staff, and you students, through emails, through Wattle sites. We have a regular newsletter and a regular video from me. But I'd also like to encourage you to keep yourself up to date. Use the ACT government website on COVID. Use the ANU COVID website. Because, as I said, things will change frequently, and things may change before I get out the information to you. And the changes can be around travel, can be around teaching, any kind of placements, any other plans that you had. Remember, the Medical Student Society is there for you, and those reps really, really help. Well, on that note, I'd just like to end here. Again, welcome you all. I hope I will see you soon live. And the most important thing that I want to say to you, have fun during this program. And I'll log off and I'll see you in the future. Bye.